I'm super happy to be delivering today's session. And I want to, of course, thank first and foremost my special guest today, but also a common friend which made possible the realization of this session. Renzo, welcome and thank you for joining me today. I would like you to turn on your camera, please. And hello, hello. I would like to give first a bit of an introduction of today's guest, as his accomplishments, his contribution are huge and of various amounts. So allow me a bit of explanation of who Renzo Guinto is. So today's guest is the Chief Planetary Health Scientist and co-founder of the newly established Sunway Center for Planetary Health in Kuala Lumpur, Malaysia, our neighbors. Concurrently, he is also the Associate Professor of the Practice of Global Public Health and inaugural Director of the Planetary and Global Health Program of the St. Luke's Medical Center College of Medicine in the Philippines. He obtained his Doctor of Public Health from Harvard University and Doctor of Medicine from the University of the Philippines, Manila. The accolades, of course, continue as he's a leader of the Obama Foundation Asia Pacific, but also a fellow of the Aspen Institute New Voices. Of course, he's also a member of several international think tanks that are shaping the conversation and action around planetary health. These include the famous Lancet Chatham House Commission on Improving Population Health Post-COVID-19 in collaboration with University of Cambridge, Lancet One Health Commission in collaboration with University of Oslo, and here I decided to cut the ongoing list. He has also served as a consultant of various international organizations, including, of course, the World Health Organization, its foundation, the World Bank, USAID, International Organization for Migration, the Philippines Department of Health, etc., etc. The last piece of information I would like to add on Renzo is that he sits in the editorial board of several specialized scientific magazines, such as we said before, the Lancet Planetary Health, the Journal of Climate Change and Health, the Journal of Migration and Health, and on and on. Without any further ado, welcome on stage, and thank you for preparing this session for me, which as we were chatting before, I'm very honored to be delivering, but also fond of. We are going to start with a presentation that Renzo has prepared on planetary health, because let's be honest, I am not a specialist of it. I have been preparing for the session. And I'm sure that our audience also has not the key information. And I think that considering its criticality, it's important to understand so that we can, do better in the future and, act to fulfill that promise of the planetary health. So over to you, Renzo.
Thank you very much, Anna, and to the organizers of this conference. I'm really, really thrilled to be part of this event, this conversation, to be able to share a bit about planetary health. And let me pull up my slides. Can you see them now?
Yes.
Excellent. So for the next several minutes, because we want to keep this short so that we have ample time for a conversation, I will be, as requested by Anna, giving an overview of this concept of planetary health. It might be the first time that you're hearing this, if you're in the audience. And so I hope that I can provide you with some basic information about what it is and why I think it is our new compass for our post-COVID future. Of course, this event, this historic international event is still very fresh. It only happened 2 weeks ago, COP26 in Glasgow. The world's governments gathered in Scotland to talk about the future of our planet and also the future of our humanity. And I'm sure you've seen a lot of editorials, commentaries that have come after that event. Some of them are laudatory, praising COP26 for keeping the 1.5 degrees Celsius target alive. But some are also quite critical and skeptical, that yes, another conference filled with promises and pledges, but what's going to happen next? And really the real battlefield is not Glasgow, but, in the places where these world leaders will be returning to. And so we should be keeping an eye on what's going to happen in the coming months in terms of fulfilling their commitments to reduce their carbon emissions and also to increase finance for climate adaptation. And, this diagram shows to you how climate change impacts human health in many different ways. We often talk about climate change as an environmental issue. Sometimes the image that comes to our mind, the first image that comes to our mind, is those of polar bears that are dehydrated, although we want our polar bears to be cute and white and fluffy. But climate change is really an issue of human health and survival. So here you will see that climate change is going to be impacting health in many different ways, from storms to droughts to flooding to heat waves. And on your right, you will see that there is no single disease group that is going to be immune to climate change, whether they are infectious diseases brought about by mosquitoes or even future pandemics such as COVID-19, all the way to chronic non-communicable diseases like heart disease or stroke, resulting from exposure to extreme heat, or respiratory diseases because the sources of greenhouse gases are also the same sources of air pollution that can harm our lungs and our hearts. And there's also a growing evidence around the impacts of climate change on mental health, both in terms of the abrupt disasters. When a disaster strikes, there is a post-traumatic stress that emanates, and it hits especially the most vulnerable, the children, for instance. But also climate change is becoming a growing slow onset and long-term concern. You have farmers that are now facing what we now call eco-anxiety because of their harvests, or low harvests resulting from extreme heat and disasters hitting their cropland. So these are just some of the impacts of climate change on human health that we should be preparing for and monitoring in the years and decades to come, unfortunately. And as already mentioned a while ago, I come from the Philippines, which unfortunately is a country that is at the heart of the climate crisis. Over the past year and a half, we've seen the confluence of climate change on one hand and COVID-19 on the other. And as you can see in this photo, the poor Filipinos are confronted with this dilemma. On one hand, do I stay in the house, protect myself from the unseen coronavirus, but perhaps my house might get inundated by intense flooding, or the roof might be blown away by the strong wind. On the other hand, do I move or relocate to these cramped evacuation centers, temporary shelters, protected from extreme weather events, climate-related disasters, but definitely, as you can see, facing a very high risk of contracting the coronavirus because, as you can see, there's no social distancing to begin with in these temporary shelters. So these are real problems, dilemmas faced by the poorest of the poor in climate vulnerable countries such as the Philippines. But it's not just climate change that is the planetary crisis or planetary threat that we are facing now. As you can see in this diagram or this set of line graphs, everything is going up. Okay? CO2 emissions, ocean acidification, and when your water in the ocean or in the sea is high in acidity, that is not very good for your baby fish, your fingerlings, or your coral reefs, and that can jeopardize the ability of our oceans to provide, food, marine food for generations to come. Of course, energy use, is connected with CO2 emissions, but also with the emission of or the release of different kinds of air pollutants, rapid deforestation, and that is very important for places like Southeast Asia, which is a tropical region filled with rainforests. Water use, right now, a lot of our fresh water sources, our lakes and rivers are highly polluted, but also overused. And fertilizer use as well, because we've been pumping our soil with artificial fertilizers as if they're vitamins, filled with nitrogen and phosphorus, disrupting the natural cycles of these important elements. And so all of these things that I've shown to you are part of what we are now describing or calling as anthropogenic change. Anthropogenic means human-induced. And these changes in the environment are induced by our myriad activities. So consumption patterns, demographic shifts like urbanization and migration and increasing population size, technological advancement. We all want our next, or we all are looking forward to the next device, the next gadget, and that is also contributing to the anthropogenic change. It's manufacturing, it's transport, long distance transport. So all of these are impacting the environment, which then in return will impact our health. And as you can see on the right, the disease groups that I already enumerated a while ago will be impacted by air pollution, water pollution, land pollution, the loss of biodiversity, and many other changes in the ecosystems. And so, as a physician, I am visualizing that right now in the 21st century, I have not just one, but two patients. One is, the human patient, like this child wearing a mask, trying to protect herself from COVID-19, but also the planetary patient, Mother Earth, also wearing her own face mask, but this time not really protecting herself from the unseen coronavirus, but from the anthropogenic changes that I mentioned to you a while ago that are afflicting a wide host of different kinds of damages to her that will eventually be detrimental to our own health as well. And so that is how this concept of planetary health was born. In planetary health, we now have two patients, both people and planet. And in planetary health, not only physicians like me can become planetary health healers or stewards or leaders or citizens. Everybody can be part of planetary health action, planetary health solutions, including those who are in the health tech industry. You have a critical role to play in advancing the health of people and planet. And because planetary health is really about everything, we have to study not just our own health, but also the health of creatures great and small, animals, plants, microbes. We also need to study the conditions of the non-living components of our Earth's life-supporting systems, the soil, the water, the air. And then, of course, we need to also investigate and understand the social systems that drive these ecological changes, the way we urbanize or build our cities, our economic systems, our political systems, the way we migrate, the way we move, the way we travel, etc. But while I said a while ago that planetary health is a relatively new concept, I also will be the first to say that planetary health, its values, its principles are also not necessarily entirely new. We can go back to indigenous wisdom, to our indigenous communities, and they would say that for millennia, they've already acknowledged the inextricable link between the health of people and the health of the planet. So as you can see in this quotation from Chief Seattle from the US, an indigenous leader, the earth does not belong to man. Man belongs to earth. Man did not weave the web of life. He is merely a strand in it. Whatever he does to the web, he does to himself. So what is now the state of our planet? And I showed to you already a few slides that are giving us some idea. One of the conceptual frameworks that we use a lot in the planetary health field is this framework called the Planetary Boundaries framework that was pioneered and developed by the Stockholm Resilience Center in Sweden. And in this framework, you will see there are 9 planetary boundaries. They're not physical boundaries. They are geochemical boundaries. They're quantitative boundaries that, if violated, will make the planet less conducive for human survival. So as you can see, 9 boundaries have been identified so far, and 2 out of 9 have already been violated. The first one is biosphere integrity, the one in red. And biosphere integrity is also a synonym for biodiversity, because over the past century, we've seen the fastest rate of extinction of creatures great and small. And we know that a high level of biodiversity is important for the long-term sustainability of our ecosystems. They also make sure that we have a continuous and a diverse supply of food and natural medicines. But as biodiversity continues to shrink, that means we will have less options as a human civilization in the years and decades to come. The other boundary that is already violated, unfortunately, which I already mentioned a while ago, is the natural biogeochemical flows of P and N, phosphorus and nitrogen, because of our addiction to artificial fertilizers in the pursuit of large-scale agriculture. So 2 out of 9 have already been violated. And unfortunately, 2 out of 9 soon to be violated as well. They're the ones in yellow. Climate change, I already mentioned to you a while ago, the Glasgow conference, and that political process is basically about making sure that we don't breach the boundary for climate change, which is 1.5 degrees Celsius increase in global average temperature. And then the other boundary that, as you can see, soon to be violated as well, is land system change. Because right now we've been turning every natural ecosystem, the natural land, into agricultural lands, into cities, into even golf courses and other stuff, right? And we know that as we humanize the land, we will be imperiling as well the capacity of land, for example, to produce trees and other life forms, etc., which will be detrimental for the planet's long-term survival. So 2 out of 9 violated, 2 out of 9 soon to be violated, and that is the state of the planet's health as we speak today. But it's also important that we don't just violate the boundaries. We also need to make sure that the social foundations of humanity are met. We need to protect the planet, but at the same time, we need to promote the health and well-being of people. And that, of course, is not an easy task. And this great economist, Kate Raworth, developed this concept of the donut economy, which is a response to that dilemma of trying to protect the planet's boundaries, but at the same time, promoting our health and well-being. And she is saying that the future of the economy should look like a donut, okay? And that is this safe and just space for humanity, that green space in between the ecological ceiling or the planetary boundaries and the social foundation. So we can't exceed the boundaries, but we cannot also have shortfalls in the social foundation, like food, water, health, energy, education, political voice, gender equality, housing, etc. So are we ready to shift towards a donut economy that ensures that the planet's boundaries are preserved, but at the same time, the social foundations of humanity are met and provided, not just to some, but to all? And there's actually a study that was developed or conducted by the University of Leeds. And in this study, they tried to answer the question, among the countries in the world, which one is closest to becoming like a donut economy? So just to summarize, as you can see at the top, you will see the highly industrialized countries of the world, the United States, and including your country, Singapore. And yes, you've almost met all the social foundations inside the donut. As you can see, not many reds inside, but there is a lot of red in the outer circle, right? And that means that you've violated, USA and Singapore have already violated almost every planetary boundary that was identified by the Stockholm Resilience Center a while ago. Meanwhile, my home country, the Philippines, as you can see, it has not violated any of the planetary boundaries yet. It doesn't mean that we don't have environmental issues domestically, but that means the planetary boundary budget has not yet been breached. But as you can see, there are a lot of reds inside because we still have poverty and undernutrition, hunger, low literacy, etc. A lot of the social foundations have not yet been fully met. So the challenge of the Philippines is of a different kind. But as you can see, Vietnam, so according to this study, the country that is closest to becoming like a donut is Vietnam, which is a 3 hours away by flight from both Singapore and the Philippines.
Yeah.
As you can see, it has not violated any of the, only one boundary, but only to a very minimal degree. And it's close to achieving many of the social foundations inside. So the question that we should be asking right now is how can we become like Vietnam? And so there's one country actually, or there's one city in the world that made a commitment during this pandemic to adopt the donut economy as its post-coronavirus economic model. And that is the city of Amsterdam. Although now, as we speak, more cities are beginning conversations on how to bring the donut into their locales, into their communities. Oops, sorry. So I know we have very limited time and we want to have some time for discussion. So I'll just share some ideas related to health systems, right? And how can health systems be part of protecting and promoting planetary health? And we've seen during this pandemic that our health systems are not ready for the pandemic, but also not ready for climate change for sure. And in the 21st century, what the health systems that we should be aspiring for is not just universal health systems, not just high value health systems, meaning patients leave the hospital and the healthcare system not just healthier, but happier. But these should be health systems that are pandemic resistant. And we've already discussed this over and over again during this pandemic, what needs to be put in place in order to prepare ourselves for the next pandemic. And more importantly, how to prevent that next one from happening. But also, how can we make our health systems climate smart? And climate smart means that we are able to adapt to the changes brought about by climate change, the health problems that I mentioned to you already a while ago. But how can we also make sure that our health systems do not become part of the climate crime? And that means reducing our carbon footprint, lowering our emissions. Because right now, healthcare, just like any other sector, is also emitting a wide range of carbon pollutants, right? And it's coming from different sources, whether from the hospital itself or from the energy that we purchase from the grid or from the medical devices, the syringes, the gloves that are manufactured by a factory. They are transported to the health facility, they are used, and then they get out of the healthcare system in the form of waste. That entire process also emits carbon. And so there are initiatives that have already arisen over the past several years. I invite our friends to look at the Global Green and Healthy Hospitals Framework, 10 things that we can do within healthcare to reduce our ecological footprint. And of course, because I'm talking to health tech, the health tech community, you might be also interested in this emerging space of how digital health, telemedicine can also be part of decarbonizing the healthcare system. And maybe later on we can have a discussion on that. So because we need to flatten the curve of COVID-19, but we also need to flatten this curve, which is the curve of our carbon emissions, our ecological footprint, so that our healthcare systems, again, do not become part of the climate crime. So I guess, Anna, I'll stop here and I look forward to our conversation. Thank you very much.
That was fascinating. Thank you so much, Renzo. It was indeed as broad as you had promised at the beginning, and really thank you for sharing such an important topic, which all of us should first of all, raise a bit our awareness, but also our education on the topics, and also how the different areas are interconnected to each other, because this is indeed the most intersectional topic that we have been dealing for sure in the Global Health Tech Summit, but also let's say the richest one globally speaking. Now, I'm not sad, but you opened so many paths for discussions that, I mean, it would be interesting to explore all of those buckets that you explained before. But we're going to focus, of course, just on healthcare. And just to summarize a bit, to extrapolate a bit, the key areas that are mostly negatively impacted by climate change, as you mentioned. The first one was, of course, the general access to health, the increase in non-communicable diseases, infectious diseases, and mental health, of course. I want to share with you also an internal exercise that we did when it comes to the access to healthcare. We are saying that it has been negatively impacted from climate change, not only because people live in disparate areas of the world, so in remote areas, but even though if in these areas, there are hospital or clinics, still these hospital or clinics might not deliver the required care that is needed in that moment. These people are forced to be displaced, as you indeed mentioned the example of the Philippines, because of the climate change impact on their territory. So the exercise that we did internally, also because we have a huge access to digital health in the world, we identified, so we put together the traditional value chain of a normal hospital, and we mapped against all of the value buckets the digital health ventures around the world. And the result is that as of today, technically, you can build a virtual hospital entirely, virtually online. So considering the core services and the supporting services. In addition, talking about the therapeutic focuses, of course, we are covering 72 TAs within, the disease areas. So the non-communicable diseases, the infectious diseases, all of these areas are already explored, and there are digital health ventures that are developing solutions in these TAs. So clearly there is potential, right, for digital health to indeed increase access and improve, the healthcare delivery and the quality of healthcare. Now, as the first question, of course, is going to be, how is digital health considered, in the community of planetary health scientists, advocates, campaigners?
Yeah, well, thank you very much, Anna. And I'm really thrilled to hear that, mapping that you mentioned. And in fact, now that we know that, there's this wide variety of technologies that we can bring together to build that, I guess, first planetary health digital hospital, right? With all these kinds of services. I think, to respond to your question, that is definitely one of the potential arenas in the digital health and planetary health nexus, right? Using digital technologies to both increase access, but also to ensure that we are able to lower the footprint of healthcare. Yeah. But also, there might be potential for digital health to play a key role in terms of, for example, disease monitoring, diseases that are related to climate change, heat-related illness, for instance, or mosquito-borne diseases that are sensitive to the warming planet, to the changing climate. And I'm sure some of these technologies are already being developed or pioneered in several parts of the world. But it is important to kind of find them and promote them, especially in places where they might already be facing these kinds of climate sensitive disease conditions. So I think those are just some of the areas where digital health and planetary health can have a really interesting marriage.
No, I hope the conversation continues, and you know, the exploration of the intersection and the common grounds, of course. Moving on, you mentioned, and also at the beginning, COP26 that happened in Glasgow, and we all assisted to that show, of course, right? And as we were also talking separately on this, it seemed like, you know, the world leaders were playing this auction game, you know, of who pledges the earliest. We are still, you know, looking at a time span of 20 to 40 years from now, which is a massive amount of time, right? So a lot can happen. There's actually a famous book of two famous economists, Freakonomics. I don't know if, they have also built a podcast from that. And they basically say that to give predictions, you know, for what is going to happen in 50 years from now, nobody will actually pay attention to actually doing that prediction, because in 50 years from now, no one will hold you accountable, right? So it's also, it seems that the same principle is applied also to COP26 leaders, because if you notice, all these leaders in 40 years, probably they won't even be alive, right? However, as I said, we're talking about a long time span. So I wanted to understand a bit with you, how will the future look like? What are some of the scenarios, you know, that will happen for sure, or that you wish won't happen, or something else that you wish could happen? Just help us a bit, you know, imagine what
right.
And manage our expectations.
Well, you know, just to comment first on your earlier remark about the future will not be holding us to account. Actually, I think we should be challenging that mentality. And instead, what we need to realize is that the future children of the world will be reading the history books, and they will say that our generation was a selfish generation because we did not make the right decisions that will ensure their survival 50 years from now, 100 years from now. So is that the kind of assessment that we want to hear from them? Although we will not be hearing that, because probably, you know, in 100 years time, unless, you know, someone has already found the fountain of youth, exactly, we will not be present anymore, right? But history will definitely have a record on our failures as a generation, the failure of COP26, the failure of the international community, etc. And when it comes to the future scenarios, I mean, we can only hope that the commitments of COP26 really indeed become implemented and enforced. Because if not, then unfortunately, a not so optimistic future awaits not necessarily just us, but again, the future children of tomorrow, right? Our children, their children, and most importantly, their health will be impacted. You know, I presented a while ago the wide range of health impacts that climate change will bring, and so I think that. And I think that bringing it to health, right, makes it even more personal and more, I guess, visceral, right? Because oftentimes when we talk about climate change, we talk about CO2 emissions, we talk about what's happening in the Arctic, etc. And sometimes that doesn't really resonate with a lot of people. Yeah. But when we, you know, put a human face and talk about climate change using a health frame, that it will actually be impacting the health of your family, and diseases that are familiar to us will be exacerbated, but also new diseases that we don't know yet may emerge. You know, more COVID-19s perhaps. We don't want that, as we've already seen in this pandemic. But if we don't get our acts together, then the likelihood of such new health crisis is becoming much higher, unfortunately.
Got it. Got it. Thank you for that. Now, as part, of course, of the many initiatives that you are spearheading, I would say, you have recently launched the Sunway Center for Planetary Health in Kuala Lumpur, Malaysia, and you are indeed the chief planetary scientist. We would like to hear a bit more about its mission and what are some of the key milestones that you are envisioning to happen.
Sure, yeah. So as you can see behind me, there are two logos, but let me focus on the new Sunway Center for Planetary Health based in Kuala Lumpur. It is a very young startup. You know, I'm talking to health tech folks, so let me borrow some of your nomenclature, right? Your jargon. We're a startup, very small team, but we're also rapidly growing. And you know, our mission is really to inject a new kind of thinking into Asia Pacific discourse around this you know, impaired relationship that we have with Mother Earth, and the importance of, you know, recasting that relationship so that, you know, both people and planet can thrive. And we will be doing research activities. We will be doing a lot of educational programs as well. We are embedded in Sunway University, which is one of the youngest and fastest growing universities in the world. And we have made a commitment to actually revamp the curriculum for the undergraduate students so that everybody, whether you're an accounting student or a culinary student or a nursing student, will be receiving basic planetary health education to prepare you for the challenges that lie ahead. So that is our mission, and we are really looking forward to collaborating with other partners and stakeholders in the Asia Pacific region, because we also don't want to our knowledge, the knowledge that we generate, to stay in the ivory tower. We want it to be translated immediately into policy and practices, especially because unfortunately the world is burning and we need to act soon, and we need to act fast.
Thank you so much. It's I'm looking forward to hear, you know, and assist to its development, and you know, what you are going to produce, because of course we are in the region and we are going to follow what's happening in the region, also because this region is quite actually affected by climate change. So it's a fascinating initiative, and all the best with that. Good luck with the endeavors. Okay, the next question is, as I said at the beginning when reading a bit your bio, you have a list of, you know, global initiatives where you are contributing and collaborating. For us listening and reading, it is positive because it showcases that, you know, there are different forces around the world that are moving towards the same direction. That's comforting, actually. I would like to hear a bit from you, if you can select some of these initiatives, and what are these about?
Oh my God, that's a lot.
It's broad, well, I know.
And let me focus on perhaps something that will resonate with our colleagues in the room or in the Zoom. So for example, I already mentioned about climate and health, that it is an urgent priority. And, you know, here in Southeast Asia, we actually established RISE Southeast Asia, which is a Southeast Asian Alliance for Climate and Health. Okay. We have national alliances as well in the Philippines, in Malaysia. We have some members in Singapore. I think we still need to build a community in Singapore. And so if you're in Southeast Asia, you're in the healthcare sector, you are feeling the sense of urgency to act on the climate, we would love to, you know, explore collaboration and to have you as part of this growing, you know, movement of like-minded and like-hearted healthcare organizations that want to not just promote health, but also stabilize the climate, because that will be beneficial for our own health as well in the long run. So that's one. What else can I share? Because I'm doing a lot of research projects on specific areas. Some of them are more domestic focused. And of course, the Sunway Center will be doing some regional projects as well in the coming years. So stay tuned.
Now, fantastic. The first one, I'll keep notes because we collaborate with, of course, the biggest pharma in the region. So it's a nice, topic to bring forward and, open at least the conversation. And because it's indeed the moment where, let's say that we're not just talking about awareness, but it's a moment of acting, right? So we are past the education side. It's the moment where we need to take action. Moving ahead, we have two last questions, and we are still on time. Okay. This last one is this penultimate one is a bit over the line of the pledges, since we've been talking so much about pledges this period of the year. What would be your call of action for healthcare leaders? Keep, of course, in the real, both pharma, I mean, all the pharma companies, the hospitals, digital health ventures, etc., etc.
Yeah. Well,
what's your, push ahead?
Sure. Well, yeah, well, I guess the commitment that we, the health sector, should be making is from now on, we will be making decisions, we will be operating without while considering the climate crisis that is happening. Because right now, most healthcare organizations around the world at all levels are operating as if the planet is not burning. Okay? Climate change is not part of the equation of our in our mission, in our job, in our practices. And so climate change has to be front and center of our work from now on. And what does it mean? I already mentioned a while ago the concept of climate smart healthcare. That means we need to both adapt to climate change, making sure that our healthcare facilities, our services, our healthcare workers are ready and equipped and resilient and adaptive to the effects of climate change now and in the long run. But on the other hand, we also need to make sure, because climate smart has two parts in its equation, adaptation on one hand and mitigation, meaning we need to reduce our carbon footprint as well. The global health sector contributes around 5% to the total global emissions. I mean, the other sectors still are larger, but 5% is significant. And you can anticipate that it has grown tremendously due to COVID times. And so we don't want to be accomplice to the crime. We don't want to be treating patients on one hand and contributing to the pollution on the other.
Sure.
So we need to start examining our own practices within healthcare, trying find ways to reduce our footprint, and then offset for those emissions that we cannot anymore eliminate. Because of course, at the end of the day, healthcare systems will operate, right? And we will still emit some carbon, but we will make sure that it is at the most minimum level possible. And I think that digital health can play a very important role in the decarbonization of the global health sector.
Totally. And just let's say probably a dark consideration on this, because I was reading some article on the topic, and actually the data centers are quite polluting. So that will be also some a factor that will need to be mitigated, of course, since also the increase in the data usage. So it's interesting and fascinating balancing work. Allow me to add one quick question on the climate smart. How climate smart do you think organizations, hospitals, as of today are? If on a rate of 1 to 10, what rank would you give?
I would say 5, overall, 5. But, there are organizations around the world that are leading the way. And I suggest to visit the website of the Global Green and Healthy Hospitals. Okay. You will see some of the stellar ones in many different parts of the world that have already adopted major reforms to lower their footprint and to promote environmental sustainability.
That's great. Yeah, I would like to do that. Okay, final question, and we are gonna cover one question from my colleague Sarah. The last question, of course, it's informal and relaxing.
Or do you want to
because
start first with a question from Sarah before you end with?
Okay, because that's technical. Okay, I agree. Okay, Sarah, thank you for the question, by the way. So she's saying that within telemedicine, there are a lot of ventures developing remote monitoring devices for health tracking. Are these additional devices going to promote planetary health? It seems that they are just unnecessary gadgets.
Very good.
Provoking. Yeah.
Yep, but very good question, because while I mentioned that digital health may be part of the planetary health solution, we should also not romanticize or over romanticize digital health, because that might be the unintended consequence. We might end up producing more and more gadgets and then technologies that will be eventually emitting their own carbon as well, and also utilizing, you know, different products or different materials that will need to be mined, or that will need to be you know, burned, etc. And so I think planetary health, if you add that lens to digital health, will maybe make the digital health or health technology sector more, I guess, responsible and judicious in the kinds of technology that they will produce and manufacture. So it's not, it's, you know, our endorsement of digital health is not a blanket endorsement. Oh, let's produce everything that we can because it's good for planetary health. It's actually about a more rational, judicious development of digital health solutions that meet our health needs, but also make sure we do not violate the planetary boundaries. Okay, so it's a big point, and I'm sure we can discuss this in detail more next time. Thank you.
Thank you so much, Renzo. Okay, last one I told you, but probably this is just for my pleasure, since we are all a bit travel deprived. Your favorite island in the Philippines?
Oh my God, I think, yeah, I mean, Palawan, you know, the last frontier. Yeah, it's the long stretch of land on the right side of the Philippines. And it's the last frontier because it's still very rich with natural resources, rare species that need to be protected, so that the future children of the Philippines and the world can still enjoy them.
Have the chance, true. I still need to visit that. Okay, we are done with the time. It was a really fascinating session, and I thank you so much for, again, joining me today and for building this session together with me. And let's keep in touch for any other next conversation. I'll be following you, so that's for sure.
Thanks, Anna. Thanks, everyone.
Take care.
Bye.
Thank you to the audience for joining us today, and just stay tuned as we have a lineup of events for this week, and all the information for what's coming next. It's either on our website or just follow us on LinkedIn. Thank you so much and have a nice week ahead. Bye, Renzo, again. Thank you.